From the JAMA Network, this is JAMA Dermatology Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Dermatology.
Hello and welcome to our listeners around the world. You're listening to JAMA Dermatology Author Interviews. Thanks for joining us. I'm Dr. Adamson, the web editor for JAMA Dermatology and host of this podcast episode. Benzoyl peroxide was first synthesized in 1858 and commercially produced in 1927. It is widely used in healthcare. In fact, it is so important that it is on the World Health Organization's list of essential medicines. For over 60 years, benzoyl peroxide has been approved and used as a foundational acne treatment without any clear alternative. However, recently, there have been concerns about the potential for benzoyl peroxide to break down into benzene, a known human carcinogen. And although to date, there are no data supporting this issue as a clinically meaningful threat to health, in a new study in JAMA Dermatology, authors examined the effects of formulation on benzene levels detected in over-the-counter benzoyl peroxide products. Dr. John Barbieri is an assistant professor in the Department of Dermatology at the Brigham and Women's Hospital at Harvard Medical School in Boston, Massachusetts, where he is also the director of the Advanced Acne Therapeutics Clinic. He is joined by co-author Dr. Michelle Wong, who is a science communicator and chemist based out of Sydney, Australia. They are both here to discuss their work in this somewhat controversial space. Welcome to the podcast, Drs. Barbieri and Wong.
Thanks for having us.
Thank you.
I'm very excited about this podcast because this is an issue that has been rocking the dermatology world as well as on social media, benzene and benzoyl peroxide. But before we dive into your study, everybody knows who you are, John. You've been on the podcast many times, but people might not be as familiar with Dr. Michelle Wong. So would you mind just telling us a little bit about yourself, your involvement in dermatology, what you do for a living, et cetera?
Hi, my name is Dr. Michelle Wong. I have a PhD in medicinal and supramolecular chemistry. I'm also qualified as a cosmetic chemist. I mostly do science communication around cosmetic products. So obviously this has been a really big topic. There's been a number of trending stories about benzene being found in consumer products. I think it started with hand sanitizer, then sunscreens, dry shampoo, and the latest is benzoyl peroxide. So I think it was March 2024 where there was the first study that came out about benzene being found in benzoyl peroxide. And then more recently, it was when it was exposed to UV, and that was published in the Journal of Investigative Dermatology. So in both of these, it showed that benzoyl peroxide decomposed to form benzene under certain conditions. The first one was with heat. There was one where they heated it up to, I believe it was 40, 50, and 70 degrees Celsius. Then the second one was looking at both heat and UV. And so this led to a lot of concern around this issue, but I would say it's been a bit blown out of proportion. There's been a lot of use of scientific terminology such as known human carcinogen and no safe level, and these have a very different meaning in toxicology.
That was a good summary of what initiated this specific study. But another question that I want to know the answer to is how did you, John, link up with Michelle on this topic? Did you approach her with this idea? I know anything related to something that is foundational as benzoyl peroxide is going to get your attention. How did you decide to come up with this specific project with Michelle?
Yeah, Dr. Wong and I have been collaborators in social media for a few years now, covering a variety of different topics in dermatology, and we often talk to each other about ideas and things that are happening in the literature or in the media. And when this article came out, we both had some concerns about the article itself, and we wanted to discuss that, but we also thought there might be some opportunities to actually use these data to draw more helpful conclusions so that we could think about how can we actually make benzoyl peroxide containing products safer and better, even if we might not be concerned about the levels of benzene that are being detected in these products from a risk and toxicology standpoint. It's still, we want them to be as low as possible. And could we use these data to identify factors in the formulation, production, and distribution that might be associated with higher levels of benzene? And then those are hypotheses about how we could improve our supply chain to make these products even safer than they already are.
And so then how did you approach this from a methods perspective? Did you take the data from Valisure from their papers and reanalyze it in some way. How did you approach answering this question of formulation and whether or not that had some kind of effect on likelihood of breaking down to benzene?
So when we looked at the Journal of Investigative Dermatology paper, there was a lot of information that was available there. They had information on brands, on product type, like is it a cleanser or leave-on product. They had information about the specific ingredients in that product. They had information about the expiration date, which could kind of correlate with how long it's been sitting on the shelf. And then they had information about the benzene levels that were detected. So working together with Dr. Wong and our co-authors, we categorized these products, and Dr. Wong can speak a bit more to this, based on some of the characteristics of the ingredients to try to understand how might some of these factors in formulation and production correlate with levels of benzene and what inferences might we be able to draw with those to think about how to design products in the future.
So this is where I want to ask you, Michelle or Dr. Wong, how did you go about deciding what products to select from that list? Because it was an extensive list of different product formulations that were used. And maybe for the entire audience, I would say, who doesn't have a background in chemistry, could you break down for us how you thought about making some of those selections in terms of deciding what to include in this analysis?
So benzoyl peroxide, it breaks down in a lot of conditions such as heat and UV. It is a free radical initiator, so essentially it's a symmetrical molecule that splits in half nicely, and when it splits, there's a bond that splits to give two unpaired electrons. So we get two free radicals. They're really good at starting chain reactions. So they're actually used for initiating polymerization in making plastics, and also that's how it kills acne bacteria. So these halves are basically benzene with an extra carbon and two oxygens attached, and there's a potential side reaction which that extra carbon and two oxygens can kind of roll off as carbon dioxide, and that gives us a benzene ring. That's how we end up with benzene. So we looked at a number of conditions that could be related to how quickly it broke down. So first off, there was the idea of heat. So some formulas, they are produced through something called a hot process. Essentially, everything is heated up to make the base, and it gets heated up to a high temperature, it's mixed, and then they allow it to cool. And when it's cooled enough, they add the benzoyl peroxide. So we thought maybe some manufacturers don't let it cool as much as other manufacturers. And for looking at this, I looked at all the ingredients of all the products, and from a sort of holistic perspective, I tried to categorize these as clearly this needed heat, clearly this didn't, and then there was some in between that I believe we just left out of the analysis because we couldn't quite tell. So obviously this isn't a perfect process. Lots of different companies will do things in slightly different ways, but we thought this could show some interesting correlations. So some things we looked for were ingredients that would have to be heated to a high temperature to melt them down before they could be incorporated into the product. We also looked at examples of formulas where there are formulas that are especially developed so that it doesn't need as much heat. Heat is quite expensive because most products are mostly water. Water requires a lot of heat to heat up. So if they don't have to heat it up that much, they probably won't. We also looked at ingredients in the formula that could potentially intercept that carbon dioxide coming off. So essentially, that benzene ring will stay attached to something else, and so it won't have the same toxicity or the same ability to be detected by whatever process Valisure is using to measure their benzene. It's not entirely clear because there's no real validated process, so they have come up with their own processes. First off, we looked at whether or not there's antioxidants. BHT is a common antioxidant in these products. We also looked at whether there's an indication that there is acid in there. So the hydrogen from the acid can come in, attach to the COO, and turn it into benzoic acid.
And so from there, John, once these specific compounds were selected, then you ran regression analysis. You want to break it down for the audience, what your analytic approach was and the outcomes that you were interested in?
Yes, as Dr. Wong mentioned, we were able to separate these products into some categories. So one of the categories we looked at was, did we think they had hot processing conditions? So we had a variable on that. We looked at, did they have antioxidants like BHT in them? Did they seem to have more acidic conditions? We also looked at the expiration date, which is sort of a measure for maybe how long it's been sitting on the shelf, which could be a proxy for formation of benzene at room temperature. And then we looked at the product type as well as the brands, because maybe there are differences in how companies do things. And when we put those into a multivariate regression model, we saw that products that had ingredients and formulas that were suggestive of hot processing, this was predictive of higher levels of benzene. We saw that products that had antioxidants or acidic conditions, as we might expect, were predictive of lower levels of benzene. We also didn't really find any meaningful coefficient for expiration date. And that really refutes this claim that benzene's forming at room temperature, at least in this data set. We definitely need more data about actual studies looking at room temperature stability, but at least looking at these data with this proxy of how long it's been sitting on the shelf, there wasn't really any evidence of benzene forming at room temperature. And the other thing we looked at was whether, again, it was a wash or cleanser or a leave-on product. And in that analysis, products that were washes or cleansers had higher levels of benzene than leave-on products. And Dr. Wong can talk about this, but these products we thought often are formed in higher sized batches, and that might mean they take longer to cool, and thus there might be a longer time of heat exposure in these products, and that could potentially lead to more benzene formation as a hypothesis for why that might be true.
What then would you tell patients that are trying to select a benzoyl peroxide product that might have a lower risk of potentially breaking down to benzene? What you show is for certain conditions, it's more possible than others. How would a regular person know what a hot press product would be versus not, et cetera?
I think a really savvy person could try to look at some of the ingredients that are associated with these things, and we include them in the figure and table legends. You'd have to be pretty savvy reading labels to try to do that. I think on a more practical standpoint, the first thing is if we just think about benzoyl peroxide containing products in general. When we look at the epidemiologic data around true risks, like do people have higher risk of cancer? Do they have higher risk of benzene in their blood? And that would be the exposure we'd worry about, would be inhalation, because there's very little absorption of benzene through the skin. There hasn't been any evidence so far. In general, the studies have been reassuring. So across the board, benzoyl peroxide containing products don't seem to have a clinically meaningful risk in the data we have available to us right now. And that makes sense because even if you look at some of the worst products that Valisure identified, the levels of benzene in those products, at least on the shelf in more traditional conditions, are not really high enough where if you kind of do a thought experiment about how much benzene is in there with typical use, you're going to have a lot of absolute exposure to benzene compared to just what we get exposed to, unfortunately, in our daily lives living in the world. In general, I think the data we have so far is reassuring about these products. It doesn't mean we don't want to be thoughtful about formulating them. It doesn't mean that we don't want to look into this more. But I think across the board in general, these products appear to be relatively safe. If someone's concerned about it, using a wash where it's not going to be sitting around and then it goes down the drain, using a short contact with a leave-on product where you rinse it off after a period of time, those could be some strategies to mitigate this further. If we're buying these products, we don't want to have them sit on our porch in hot weather if we bought them online or something like that. We want to be thoughtful about conditions where they might be exposed to heat, which really does increase the rate of degradation of benzene. And I think this study, one of the real value of it is it gives us some hypotheses for companies that are making these products to think about their formulas and how we can design products that are going to have a lower risk of benzene formation, and then we can make them even safer than they already seem to be.
So what I take from what you're saying is that your study is more of a thought experiment of trying to think about potential formulations that may put a product at risk, rather than necessarily showing that this causes some untoward outcome. And consumers of benzoyl peroxide should be rest assured that their products, from a health and safety standpoint, as far as we know, are perfectly safe. Is that a fair assessment?
I mean, just like any study, it's looking at associations. This isn't a causal analysis. We're not going and testing different formulation strategies and seeing what happens. We're looking at variation in the marketplace of products that were tested by Valisure, and we're trying to understand that variation. And what we show is a lot of that variation, almost more than half of it, can be explained by these formula characteristics. And so that gives us some hypotheses that then one can test. Those are kind of the next steps to see if we make formulas that take into account some of these ideas. Can we then reduce the likelihood that they break down to benzene, especially maybe if they're exposed to some of these conditions that we know increase that risk, like temperature and other factors?
I think it's worth pointing out that with risk, nothing is risk-free as much as we'd like that. And reducing small risks is good on a large scale when you're producing a product for a very large number of people. But if we look at the actual risk numbers for you as a person using benzoyl peroxide, it's actually quite reassuring. So even with Valisure's own data, they compared the amount of benzene in a compact car with the amount that would cause a 1 in 100,000 increased cancer risk after inhaling it for 78 years. So on a population scale, if you are making a product that is putting out millions of units, then that would be important. But on an individual scale, essentially they worked out that if you leave a product in a maximally hot car, so something, I believe they compared it to a car that was sitting in the sun in the middle of summer in Georgia for 18 hours, and then you got into the car, didn't air it out, and breathed that air for 78 years, then you would have an increase 1 in almost 8,000 cancer risk. So when you put it in that way, then the risk is actually quite reassuring. But again, it is good to minimize these even small risks.
I also want to applaud both of you for this work. It's one thing to push back against it in social media, which I think is really important, but also to leave the imprint in an academic space as well, using data like this to challenge people that are putting out research and information that may be somewhat scary and not perhaps in the context that it should be in. And you guys took a really measured approach in considering some of this risk that, as Dr. Wong pointed out, is extremely small. And lowering that to even smaller, while it may be something that is important, we got to realize that it really is something that is small. Do you think that's a fair take, John?
I think it's easy with this kind of topic to be like, benzoyl peroxide products are going to kill you, knock them out of everybody's hands. We've got to throw them all away. And it's also easy to have as a dermatologist, because we use this product so much and it's so critical to treatment for a number of diseases, to just be resistant to any evidence you see from Valisher and go, this is a non-issue, we don't trust the data, those kinds of things. And I do think it's important to be nuanced about it, to take this issue seriously, to be thoughtful about how can we make these products as safe as possible, but also to avoid kind of blowing the conclusions out of proportion to the actual toxicology risk to individuals, to the actual epidemiology data on the safety and potential risk of these products. And so I do think that being thoughtful and nuanced about this topic is important, and being careful about not on either side. I think it's very easy to both kind of fearmonger about these products and also to not take into account the actual potential risk of benzene and things as well.
Where do you all go from here? Is there going to be a follow-up study, or going to look at some other products? What do you think needs to be done moving forward?
I think now it's really up to the producers of the products to do their own investigations. I'm sure that's already happening, and make their products a bit safer. It would be really nice if some of these companies did put out their own data to just reassure people that this is an issue that is being taken care of, and to give us a better idea of the actual risk.
And then on the clinical side, there's opportunity for continued both prospective and observational and retrospective studies trying to understand the actual risk and potential harm of benzoyl peroxide products and whether that exists or not with routine clinical use, to try to understand whether in routine clinical use, when in people's hands, is benzene actually forming in the products, and how and what things contribute to that if that is happening. And then just like Dr. Wong's pointing out, there's, I think, an opportunity for manufacturers to think about how we can make these products as safe as possible and to share their own data to try to give us some more information and context for this. Right now, there's a lot of data being put out by Valisher, and there's not a lot of data that we're seeing from other groups, and it makes it a little bit difficult to understand the total spectrum of the picture here.
So I want to thank you two so much, John and Michelle, for being on this podcast. This was such a great conversation. I'm Dr. Adamson, and I've been speaking with Dr. John Barbieri and Dr. Michelle Wong about the effects of formulation on benzene levels detected in over-the-counter benzoyl peroxide products. You can find a link to the paper in this episode's description. This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. Thanks for listening. Catch you on the next episode of the JAMA Dermatology Podcast.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.